Most importantly, there are certain things that you want to avoid at all costs saying and doing when you're talking to patients. And those things are, hello human. Hello human, you have clicked on this video because you want to learn how to better communicate with your patient. And if you keep on watching this video, you will achieve just that. As you can tell from the title of this video, we are going to talk about therapeutic communication. But what is therapeutic communication and what is it for? Therapeutic communication is a way of interacting that focuses on advancing the physical and emotional well-being of a patient. We use it not to just make conversation, but to direct the conversation in a way that allows the patient to express his or her feelings. It's not about you, and that is the most important thing that you need to keep in mind. Before we begin, don't forget to give this video a big thumbs up, and if you don't want to miss any of my new content, make sure to hit that subscribe button and the bell so you're notified anytime I post a new video. Without further ado, let's jump right in. Like I said, therapeutic communication is a way of interacting that focuses on the patient, and there are several techniques that we can use to achieve just that. I'm going to mention 11 therapeutic communication techniques, what they are, and how you can use them. The very first therapeutic communication technique that I want to mention is the most important one by far, and this is active listening. Has it ever happened to you that you're having a conversation with someone and you're not actually listening to what they're saying, but you just listen to like the first 2 words they said and now you're just thinking of how you're going to respond? Don't do that. Don't do that with your patient. Actually, don't do that with people in general. It's rude. Active listening isn't something that you can just use with your patients, but with people in general. It means to completely listen to every single word the person is saying and finish processing what they said before you start jumping your wires and thinking. This will allow you to be attentive to the details in the conversation that will help you really guide and gear this conversation where you want to get it to. The second therapeutic communication technique that I want to mention is quite unexpected and counterintuitive. It is the use of silence. It's not always necessary to be saying something. Sometimes being quiet is exactly what you need to do. We use this technique to allow patients to reflect on their feelings without any interruptions. For example, if you enter a patient's room and they are grieving about their recent diagnosis, or you're entering the room and the patient just passed away and their loved one is there grieving that loss, you don't have to say something. There's no need for you to jump in and splurt out words. Sometimes it is therapeutic and necessary to just sit down, make yourself helpful, make yourself available, and say nothing. The third technique is called focusing. I like to think of this as redirecting the conversation. Sometimes you're going to ask patients a question about their dietary habits, and whether it's on purpose or not, they might go tangent on that conversation. They might start telling you about the eating habits of their aunt or what they had for last Thanksgiving. That's not really helpful to our conversation right now, is it? So if they're telling you what they had for Thanksgiving and what their aunt has been eating, you're going to first validate what they just said, so make it known that you were actually listening, because remember, active listening is the most important, and then refocus it. So you can say something along the lines of, I'm glad you got to enjoy that meal, and it's really interesting to hear about what your aunt has been eating. But going back to the topic in question, what dietary habits have you been employing? It sounds rude, but it's not. You're not having these therapeutic conversations out of pleasure. You're not having them out of your need to socialize. You're having them with a goal to explore the patient's feelings and concerns. And you need to be stern about that.
You might have noticed that I'm wearing quite a distinctive crop hoodie. I got this from a store called Purpose People. It is a small business run by a nurse. I love supporting small businesses, and you should too. So go check out her store. The description is in the link below. And no, this is not sponsored. I just love supporting small businesses. Back to the video.
The next technique is to use open-ended questions. As opposed to closed-ended questions, which can only be answered with yes or no, open-ended questions can be answered with anything. A very clear example of this is you enter the patient's room and the patient's crying. A closed-ended question would be, are you sad? Yes or no. That's not very therapeutic, and it's kind of stupid to ask someone if they're sad if they're crying. Just saying. But the open-ended question would be, how are you feeling right now? This allows for the patient to pull more information out of their brain and give you something more substantial than just a yes or a no. The fifth communication technique is called clarification.
We use clarification to make sure that we know what the patient is actually saying. So for example, if the patient just went on and on about how he's frustrated with his mother, how his mother doesn't let him do what he wants, etc., you can clarify by saying, I'm hearing you say that you're angry at your mother. The sixth communication technique is called exploring. This is when we're going to ask the patients for more details. For example, if you're asking them about dietary changes or dietary habits, and they tell you very shortly that they haven't really been following it, and then they go on to talk about something else, a way of exploring would be, tell me more about the reasons that are keeping you from following your diet. Or tell me more about your concerns about this diet. Tell me more. That's what exploring is about. The seventh therapeutic communication technique is actually one of my favorites because this one is so funny. It is to restate what the patient just said. The reason this is funny is because it's exactly what it sounds like. You are basically repeating exactly what the patient just said. And the reason this one's my favorite is because you're actually making the patient hear from another mouth what they just said to you. This sounds exactly what it sounds like. So for example, if your patient tells you something like, I hate being in the hospital, restating would literally be, you hate being in the hospital? You say the exact same thing, but you add a question mark at the end. And when they hear what they just said, something happens. Just try it, it's quite fun. The eighth technique is called paraphrasing. This is kind of similar to restating, but I see it more than for the purpose of the patient to hear what they just said, for you to make sure that you're understanding correctly. If you hear somebody say something, like a quote, an inspirational quote, or a part of a book, and you're able to explain that exact same quote with your own words, that definitely means you understood what the quote was talking about, right? It's the same principle here. You want to make sure that you're understanding what the patient is saying to the point that you can say it back in your own words. The ninth therapeutic communication technique is called reflection. This I see kind of as interpreting what the patient said. We want to help the patient identify exactly what they are feeling and why. So for example, you enter a patient's room and they're complaining about the bed being uncomfortable, the TV not having enough channels, the food being bad, their family not visiting, and their IV hurting. You might want to do something about that last one though, just saying. But with all those things, if you want to reflect, what you can say is something along the lines of, you seem angry or you seem frustrated with your current situation. Want to tell me more about it? The 10th communication technique is called providing leads. This in essence just means providing a topic of conversation to lead the discussion. So for example, you can enter the patient's room and tell them, tell me about your family relationships. How's your support system? Who are you close to? By the way, parentheses, what I just did, don't do that. Don't ask more than just one question at a time. Let them answer that and then do another one. A better example would be to say, tell me about the people you live with. That way you're setting the topic to be their social network, their relationships, their support network. And from there, you just set the topic. The 11th therapeutic communication technique that I'm going to mention is summarizing. That's pretty straightforward. You take everything that the patient just said and you basically summarize it. This kind of helps you and the patient stay in the same page, on the same page. Forgive my English. Now that we've talked about all these different communication techniques, let's talk about the things that you need to avoid when talking to patients. The first thing that you want to avoid is giving any sort of advice that is not medical. What do I mean by this? You're allowed to tell them to stop smoking. You're allowed to tell them to eat a healthier diet. You're allowed to teach them in the middle of the conversation. That is part of your job. What you're not allowed to do is make this conversation social to the point that you're actually giving them life advice. For example, and I'm going to use a very extreme example just to stress this point. You're talking to a patient who's a woman and you learn that they are living in an abusive relationship. You're not allowed to say things like, you should leave that pig, you should leave that man, you need to get out of there. You can't say anything like you would say it to your best friend. But you have a duty to this person to help them protect themselves. So we are going to use all those 11 therapeutic communication techniques and help them come up with a plan for them to deal with or escape that situation. For example, after you've learned that they're in an abusive relationship, you can use reflection to say, it seems like you're living in an unhealthy environment. Tell me about any safety plans you have in case this gets worse. You're allowed to start the conversation, and I definitely advise you to. But do this without giving personal advice. Something else that you definitely don't want to do is ask why. Now, there are certain exceptions to this rule. If they tell you that they haven't been taking the medication, you can ask why. Why haven't you been taking your medication? That is fine. But you can't do it in a way that is questioning the patient or their motives. So things like, why would you do that? Why would you act that way? Those things are very accusing, and you definitely don't want to say that to your patient. Something else that we want to avoid, and I'm sure you wouldn't like this if somebody did it to you, it is minimizing. Now, I am a minimalist, so minimizing is something that I do on the daily, but in a good way. You definitely don't want to minimize the patient's feelings, experiences, or concerns. For example, if you have a teenage patient that is talking about how they wish their breasts were bigger, or their acne was gone, or they were prettier, or blah, 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 don't say something like, oh honey, everybody goes through that, it'll get better. That's terrible. You want them to feel safe to express their emotions and feelings without you tearing them down. Don't do that, please. You also don't want to provide false reassurance. If your patient is concerned about the surgery that they're about to have, and you're in there in the room with them and they tell you that they're concerned about the surgery, don't just tell them, oh, this is routine procedure, it's gonna be fine, the doctor's done this a million times. If they have a diagnosis of cancer and their prognosis is really bad, don't tell them that they'll push through it and that they'll be fine. Do not offer false reassurance. Something else that you don't wanna do is disagree with the patient. Again, this is not about you. We are not conversing with this patient so that you can get your opinion and your feelings across. Even if you disagree with the patient, suck it up. This is about the patient's feelings, and you are going to find a way to validate them. And something else that I already mentioned previously is the use of closed-ended questions. Try to avoid these because a yes or no conversation doesn't really flow. So let's put this to practice. I'm going to ask you a question and give you a series of options, and you are going to be able to choose which one is the most therapeutic response by the nurse. Your patient is grieving their lost loved one. Which of these things do you say or do? You will feel like this for a few weeks, and then you will feel much better. You should join a support group. Are you sad? Your spouse is in heaven with God. I'm sorry about your loss. I will be here with you if you want to talk. You can pause this video now and I will give you a few seconds to decide on your answer, and then we'll go through it together. The first option is not correct because this is minimizing the patient's grief. You can't assure that they're gonna feel like this for a few days or weeks or months. Everybody goes through their own unique grieving process, and you need to respect that, and they need to be prepared for that. So the first one is incorrect. You should join a support group. This one sounds very good because it is considered medical advice, but this response is not very therapeutic. You're failing to acknowledge the patient's feelings before you actually give them advice. Are you sad? This is a closed-ended question. Like we were saying before, they can only answer with yes or no. And it's kind of stupid to ask if they're sad if their loved one just died, no? Yeah, hope you agree with me. Your spouse is now in heaven with God. I believe in God and I am a follower of Christ, and if a patient asks me what my beliefs are, I am allowed to share that. But I am never going to go and push my beliefs on a patient, ever. Just don't. Obviously, the only one we're left with is our last option. I'm sorry for your loss. You're acknowledging the patient's feelings. I will be here if you need to talk. You're making yourself available for the patient. That is the most therapeutic and the right answer. Remember, it is not about you. It is about your patient. Try to put yourself in their shoes and treat them how you would like to be treated if you were in their situation. I know this kind of communication feels very forced at first, but with some practice, and sometimes a lot of practice, you will master this skill and be able to communicate with patients in a therapeutic way. Thank you for watching this video. Don't forget to give it a big thumbs up and to subscribe if you don't want to miss any of my future videos. Go take care of your patients.